Hello, my name is Madeline Alton and I'm a junior in the nursing program at Concordia. In this video, I'm just going to be talking about a patient that I recently worked with in MedSurg Clinical this semester. So just a little background on my patient. He goes by the initials of MN. He is a 68-year-old African-American male that was admitted to the MedSurg unit on October 6th with a C1 through C4 level spinal cord injury with central cord syndrome. So after heavily drinking one night, he experienced a fall with severe weakness causing this injury. His other medical diagnoses related to this hospital visit include hypertension, ventricular tachycardia, hepatitis C, opiate addiction, asthma, depression, and neuropathic pain. He is a full code patient with no known allergies, and his most recent set of vitals after being admitted onto the unit reveals heart rate was 62 beats per minute, his blood pressure was 154/74, respirations was 18, and his temperature was 98.6. So the chronic condition that my patient had that I'm going to be discussing today is hypertension. So what exactly is hypertension? It's also known as high blood pressure, and it's a chronic condition in which the force of the blood against the walls of your blood vessels is too high. So when your blood pressure becomes too high, it can cause problems with tissue perfusion, which regulates the circulation of blood flow throughout your body. MN is defined to have stage 2 hypertension, which is defined by a systolic blood pressure over 140 millimeters of mercury or a diastolic blood pressure over 90. In regard to signs and symptoms that my patient had related to hypertension, it is often considered the silent killer because most patients with this disease are asymptomatic until it becomes severe, as it is secondary to the effects on the blood vessels causing an increased workload on the heart. So my patient developed ventricular tachycardia due to his chronic high blood pressure, but this is the only secondary symptom that he did have. However, other symptoms to be on the lookout for in relation to this condition are fatigue, dizziness, angina, and dyspnea. So as far as labs go, my patient did have a few pertinent labs related to his diagnosis of hypertension. Although lab testing is not a diagnostic tool used for hypertension, it is extremely important to frequently monitor certain labs in order to be able to detect conditions that could be a complication of his high blood pressure or worsen his condition if it's not controlled properly. His total cholesterol level was 215, which is moderately elevated as the normal level is less than 200. High blood pressure and high cholesterol are closely linked together. When the arteries become hardened and narrowed with cholesterol plaque, the heart has to work so much harder to effectively pump blood throughout the body. His sodium level was 137 and his potassium level was 4.1, which are both within the normal range, but these are important to continue to monitor as certain medications can affect these levels. The level of potassium in the body is also extremely important because potassium lessens the effect of sodium, and these electrolytes directly have an effect on the heart. His GFR, or glomerular filtration rate, was 132 milliliters per minute, which is normal. However, this is also important to monitor because hypertension is one of the leading causes of chronic kidney disease. So because hypertension is irreversible, the goal of pharmacologic and non-pharmacologic interventions are to keep the blood pressure well controlled and to prevent the development of cardiovascular disease or other complications. As far as medications go, MN is prescribed for antihypertensives, including metoprolol, which is a beta blocker, amlodipine, a calcium channel blocker, lisinopril, an ACE inhibitor, and hydralazine, a vasodilator. Other interventions that would be implemented include the DASH diet, which stands for Dietary Approaches to Stop Hypertension. This includes foods with less sugar, salt, and less red meat in order to effectively lower blood pressure and reduce cholesterol levels. In a research article that I found, it discusses the importance of the DASH diet in patients that have hypertension, and studies found that compared to a controlled diet of someone in the US of typical food consumption, the DASH diet produces reductions in systolic and diastolic blood pressure of 6.8 and 3.7 millimeters of mercury among Black individuals in just 2 weeks of implementing this program. So this just goes to show how important this program is to implement and hold themselves accountable in order to keep blood pressure controlled. A dietary restriction of sodium intake less than 1,500 milligrams per day should also be implemented in order to control blood pressure and potentially allow for lower blood pressure medication dosages. Another important intervention is to implement physical activity for at least 30 minutes a day, 5 days a week. This can be done to lower blood pressure and promote relaxation. Some important education I would teach my patient before discharge includes how to properly read food labels of prepared and packaged foods, as well as health products that have hidden sources of sodium in them. This is important because my patient should be on a strict sodium diet to prevent other cardiovascular diseases and control his blood pressure. I would also teach him about foods that are naturally high in sodium that I would avoid, such as lunch meat, soup, bread products, and poultry. Other teaching points include adherence to the drug regimen, as the non-pharmacologic interventions are not enough to control his blood pressure since he already has stage 2 hypertension. Lastly, I would teach him about different activities that he can do to fulfill the recommendations in order to gradually increase his activity levels. Thanks so much for watching. Hopefully you learned something.